Next, we've got a video presentation. This video presentation will bring greetings from international collaborators. Here is this video presentation.
Hello, everybody. I'm Dr. Prabha Chandra from India, a professor of psychiatry and the Dean of Faculty Behavioral Sciences at the National Institute of Mental Health and Neurosciences. And I bring to all of you greetings from India. And I wish the second annual conference of mental health and well-being at Guyana in Georgetown great success. Indeed, I would have liked to be with all of you, but I'm sure I can assure you that I will do it the next time and join you in your next conference. As Guyana starts thinking about mental health and the programs related to it, I would like to emphasize that there's a lot that we can learn from each other. We have a lot in common. We have a common heritage. We also have strong sense of religion and spirituality. And we also are a collectivistic society, and families are a great protective factor for mental health and our well-being. But we also know that there are a lot of risk factors. There are high rates of suicide, domestic violence is a problem, and there is a lack of trained human resource in the country. So as we start thinking about what we want to do as we go ahead and during the conference, I think there are two things that I would like to emphasize and that we can partner in and collaborate to take it forward. The first is training mental health professionals. I think it's very important for us to have a very strong training module so that we can reach community health workers, midwives, community nurses, primary care doctors, in order to overcome the lack of trained mental health professionals. There are many programs available, newer teaching methodologies, which are very useful and have been tried out in many countries. And it would be wonderful if we can collaborate in trying to overcome the problem of a lack of health professionals, particularly mental health professionals, through these teaching methods, particularly using telepsychiatry and online training methodologies. The second part that I would like to emphasize is the role of prevention and promotion of mental health. And that is where working with women and young children and young families becomes very important. We know that a lot of the mental health problems that happen later in life, including physical problems, start with prenatal stress. So the important role of preconception mental health, supporting women they are pregnant, screening for mental health problems, providing a stepped care approach, including with midwives, integrating mental health into routine maternal care, working with young babies, and supporting children in the 1001 critical days of their lives by supporting families and helping them in parenting, decreasing violence in families, and enhancing promotive and protective methods for mental health goes a long way in improving population mental health. So I'm sure that many of these things will be deliberated upon. We will be talking about them. And I assure you that from India, we will be available for any kind of collaboration that we can provide and support the program in any way possible. Once again, I wish you good luck and I wish the Congress and conference great success. And I hope that I will be available to join you in the next few conferences. And I'm really positive and optimistic that this program is going to be a great success. And I'm sure that with the kind of commitment that the policymakers, the ministry is showing towards mental health in Guyana, that we are going to see a lot of good results very soon. Once again, thank you very much for inviting me to be part of this conference, and good luck. Thank you.
Good morning. This is Dr. Afzal Javed, President, World Psychiatric Association. It is indeed a great pleasure and privilege for me to extend greetings from World Psychiatric Association to our colleagues who are having the meeting in Ghana. This is an important event as there are discussions about different aspects of mental health and how to promote well-being as well as prevent mental disorders and mental illnesses. It is indeed a great opportunity for all of us to learn more about the country, about the culture, and also about the mental health services that we would certainly like to support in the coming days. I wish the Congress a real success and hope WPA will continue with this collaboration in coming years. Thank you very much.
Good morning, good afternoon, and good evening. Greeting from the United States and from the National Institutes of Mental Health. I am Andrea Herbert Marquez, a public health psychiatrist, and I have the honor to be the project officer of two studies from Dr. Hoven and Dr. Musa and this wonderful team in Vienna. Unfortunately, I will not be able to attend this conference in person this time. However, I understand that you're going to hear and exchange knowledge from different stakeholders from Vienna and all over the world to help to address issues related to mental health, suicide, injury, and trauma prevention in Vienna and around the world. I wish you all the best on the next 2 days, and I'm looking forward to see you soon in person. All the best luck. Bye-bye.
Hello, my name is Dr. Warren, I'm Professor of Psychiatry at Columbia University Medical Center, as well as the President of the American Academy of Child and Adolescent Psychiatry. I'd like to welcome you all to the second annual Guyana Mental Health and Wellness Conference. This is an incredible meeting to look at specific issues of mental health, suicide, trauma, and injury prevention. I am excited for all of you to attend this conference. Thank you.
Hello, my name is Norbert Skokauskas. I'm professor of child and adolescent psychiatry at the largest university in Norway. I'm also the chair of the WPA Child and Adolescent Psychiatry section, the first and one of the most active sections at the WPA. Today, I have a great pleasure and honor to welcome you all, local participants from USA and all the world at this beautiful Guyana conference, the second conference on mental health and suicidal behavior. I would like especially to extend my greetings to Professor Christina Hoven. I think everybody agrees with me that she is the main reason why this meeting is happening. I also would like to extend my greetings, my special greetings to two fellow child adolescent psychiatrists who are doing a very important job with limited resources. I am not with you today, but I hope to see you all, or at least some of you, the next week. Please enjoy the meeting, and I hope that the knowledge and the skills you will gain at this meeting will help you to become better clinicians, better professionals, and ultimately to improve the life of your patients and their families. Good luck.
Hello, my name is Danuta Wasserman, and I am Professor of Psychiatry and Suicide Prevention at Karolinska Institute, Stockholm in Sweden, and also President-elect for the World Psychiatric Association. I would like to welcome very, very heartily to your second nationwide conference on suicide prevention and, of course, on mental health promotion. Because there is no suicide prevention if you do not at the same time promote the mental health of entire population. I congratulate your government, your officials, and Professor Christina Hauber together with her entire group for this endeavor and to this wonderful project in very well-defined epidemiological catchment area. I would like to welcome you to your second meeting on suicide prevention and mental health promotion. Thank you.
Greetings from India. I had the pleasure and privilege of being with all of you last year. I had hoped to be there with you this year also, but unfortunately, I had to come back. In her opening remarks last year, Professor Christina Hoven said that Guyana should come off the list of the top 10 countries with the highest suicide rate. I reiterate and echo her sentiments, and I would urge all of us to work together and see that in the next 5 years, Guyana is off the list of the top 5 countries with the highest suicide rate. Under the dynamic leadership of the Honorable Minister, Dr. Frank Anthony, the collective commitment and will of all of you there, I think this is totally achievable. My best wishes for the conference and the warmest regards to all of you.